In animation, a dozen concentric bands in various colors and textures swirl behind the words Ability Summit.
Logo, the prompt with Trevor Noah, a rural audiology clinic. Patients are seen.
In Australia, we have anywhere from 20 to 80% of Indigenous kids have ear disease. If hearing gets impacted early on, it has an impact on your school performance, your future employment opportunities, and that's why we're so focused on trying to get involved early to hopefully prevent ear disease becoming hearing loss. Not all ears are the same, and so as a medical doctor, you take time building that pattern recognition in your mind. But someone who is in a rural community doesn't get that same chance. Some of these people have to transfer all the way over to a tertiary center. What if AI could help you understand what's going on in that ear now? What if you have an AI-supported tool that helps them understand what they're seeing? For people to stay home, to be able to live in their community which can service them, that's empowerment. That's what we want to see.
A laptop attached to a camera on an otoscope. Logo, Microsoft. In the studio,
Thank you for
Jenny.
joining us for a really great conversation about AI. I'm joined by two doctors. I'm joined by Dr. Juan Lavista, who is the head of our AI for Good Lab and chief data scientist, and also joined by Dr. Al-Rahim Habib, joining us from Australia, from Brisbane, who works as an ENT doctor and the founder of an incredible startup, Drumbeat AI. Thank you both for joining. I'm going to get right stuck in here and actually go straight to Dr. Rahim. I really want to talk about Drumbeat AI. I have been fascinated by this project. It is about identification of ear disease. That is something that impacts an incredible number of kids. Of course, I was one of them, and my process was quite long and honestly pretty arduous. You are doing some amazing work to really leverage AI to bring that not just to communities that don't always get access to that healthcare, but to speed up the process as well. Can you share a little bit about Drumbeat AI, how this started, and what you found through the project?
Al-Rahim on video.
Well, thank you very much for the opportunity to be here. We're incredibly grateful, and I'm so excited. Drumbeat AI really started with the ear, which is a beautifully complex and intricate structure. And what we were finding that in Australia, we have some of the highest rates of ear disease in the world. And one of the challenges is that there are a number of social determinants of health that center around ear disease, and that relates to overcrowding, poverty, accessibility to healthcare services. And one of the other aspects is being able to identify when a child has ear disease. So often many children go undiagnosed or untreated. And this project revolves around the ability of someone who doesn't have a lot of experience looking in the ear, but integrated into a community, empowers them to have the chance to look at the ear at the same quality of an ENT specialist, for example. And so what we've been doing over the past few years is developing a tool based on thousands of images from over 100 different Indigenous communities and over 4,000 kids that's centered around being able to understand the eardrum. As an ENT doctor, we have the opportunity of looking in hundreds or thousands of ears, and we develop this pattern recognition algorithm in our head. But if you're at the front line in a rural or regional community, and you may not have had that opportunity, identifying key macroscopic factors on the image can be a bit challenging. And this tool really enables you to do that very quickly. And so you can see a child, take a photo of the eardrum, and instantly be able to understand what pathology is occurring and how you can take the next steps to refer that child or treat that child for ear disease and to prevent long-term hearing loss.
And I think what you're doing is tackling something that's really important as we think about accessibility. The quicker that we can get diagnosis of a disability, the quicker that treatment can happen. How are you seeing the impact in communities, and then how people are then getting powered up with the support they need once you do have diagnosis? And I know a lot of this is happening in Indigenous communities in Australia that don't always get access. They are rural and hard to get to sometimes. Is that right?
Yeah, that's absolutely right. And there are some beautiful parts of the country in Australia that are extremely remote and regional and quite difficult to access. So specialists often are not as easily linked to these communities. And so often these children can be undiagnosed and unfortunately don't receive treatment in these settings. And so one of the key aspects of this project is improving accessibility by early detection. In Australia, we've seen that there is this surge of being able to look inside the ear with new tools. And the old way of looking in the ear was an otoscope that doesn't have a camera. So your doctor would try and describe what you see or draw an image. But now we have this incredible opportunity to take a photo of the eardrum. And that speaks, over 1,000 words because it allows you to understand what is happening. It's engaging for children, even from my own experience, being able to show kids what their ears look like and integrate with families and discuss that. But now we have the AI component. So when you layer that on top, now you have the ability of being able to not only see the eardrum, but understand the eardrum. And so those two link together as an incredibly powerful tool to enable someone in a rural community to now be able to provide incredible services for that child right there. And that links us up and shrinks the gap because now we can understand what's happening at the front line and hopefully start to mobilize resources for those kids. And the ultimate goal is to minimize the gap between assessment to treatment.
That's fantastic. I want to broaden the conversation and bring in Dr. Juan, who leads our AI for Good lab and an incredible team of data scientists researching and advancing the use of AI across multiple areas. We've had the honor of working with your team on a few things to do with accessibility, speech, and how we compare people with ALS, understanding currency with seeing AI. What do you think is the opportunity for AI as we think about the project that you've been running with Dr. Rahim, but also other aspects of disability, cancer, leprosy, I know are just a couple of the areas that you've been digging into?
I think
Juan in the
so
studio.
AI has a huge potential, and like I mentioned, not only in accessibility, but especially in accessibility in the sense that we can help change lives in many ways on how people work and people interact with technology. I think that that's something that this technology has, like the new technology has shown that through you can use now your phone to navigate through the world. You can have areas like automatic translation. There are multiple ways where you can enable accessibility scenarios. On healthcare, and this is something that, again, Rahim and I have been working now for a few years, that is a scenario that is looking at a picture and trying to help a doctor do a diagnostics through that picture is something that happens across multiple different scenarios in healthcare, from looking at the fundus images of your eye to understand whether a child has or doesn't have retinopathy or prematurity, from understanding a CT scan whether the person has cancer or not. All of these problems, even though are very different, they're from an AI perspective are basically the same problem. For us, in order to work on this, we need the most important aspect of the project is to have the right partner, in this particular case, Rahim. But in every project we have a subject matter expert on these problems, and we work together with these subject matter experts because our expertise is computer vision and AI modeling. It's not ear.
The ear.
Yeah, the ear.
Right.
So for every project we have, we must partner with someone that has this subject matter expertise. I see huge potential. It's happening now. A lot of these problems are being worked now. But I expect that in the future we will see many more of these scenarios, helping doctors, helping patients around the world, and helping people that have with accessibility on these scenarios. So.
And you cover most of these scenarios in your book, which is beautiful. It's called AI for Good, and it walks through, I've been reading it again. It walks through all these different projects that you and your team have gotten involved in, anything from glaciers to giraffes, to understanding the impact of a natural disaster. I know your lab has been growing recently. You're in Redmond, literally like just over the road here, and you're moving to Nairobi. As you think about future projects and where you're going and what you've learned from all that you put into the AI for the Good book, what's the most impactful? What are the projects that really speak to you, that articulate where AI is going to go?
It's difficult to choose between projects. It's like choosing between children in many ways. But I would say healthcare for us has a huge, I'm very passionate about the problems that we can help with healthcare. We live in a world where 50% of the world, like 4 billion people, do not have access to talking to a doctor, basically. But still at the same time, we have 80% of the population that have access to smartphone and access to the internet. And these smartphones, even like a lower $100 a smartphone, has a processing power that was more than a supercomputer back in the 90s. So we can run a lot of AI models now on the edge. And we think there's like huge potential from that perspective. The technology has shown that a lot of the problems can be solved. We still need to work to make sure that we make it to production in some of these projects. And that's usually the most difficult part. Solving a problem in a paper is the easy part. Making it to production, for very good reasons, particularly in healthcare, is the one that is more challenging. So my hope is that we will get, as a society, we will get better at solving that last mile.
It's exciting, and it's also, one of the big points we make always with AI is that you've got to have the human in the process. Yes. And in this instance, we have to have the expert in the process. And I have to say, I get really excited about the possibility of that early diagnosis, whether it's ear disease, eye, whatever that may be, because if we can cure it, great. But if it can't be cured, you can help that person live with technology, with the right support as a person with a disability, which is the journey that we've been talking about today at Ability Summit. But let's just talk about the future for a second, Dr. Rahim. You've got an incredible vision for Drumbeat AI and where that wants to go, and also the opportunity for the world as you look at AI. I think busting out of the shores of Australia is on that list. Where do you want to see Drumbeat AI go?
That's a great question. I think for kind of couple areas. I think the first is that we're seeing clinicians adopt AI more, and we're seeing it in multiple layers of practice. And I think that's a really exciting next level of what healthcare can provide. Following up with what Juan was saying, I think accessibility is the next goal that we want to achieve. Ear cameras that can collect photos range in cost, and we don't want there to be barriers. So we want to be able to integrate with all types of cameras so that the ability for someone to look in the ear and make that assessment is really easy. And entering the opportunity to try that should be minimal, if anything. So we want it to be something that can be easily accessible and global. And that's the next phase, is that ear disease is not just an Australian issue. It's something that we see all around the world related to a number of different social determinants of health. So if we have the opportunity of expanding our tools so that we can see this in a global setting where we have, as clinicians, the chance to track prevalence and incidence rates of ear disease, the ability to mobilize resources when we see spikes or large volumes of kids that need to be assessed, that can take this issue, looking inside the ear, shrinking the gap to treatment, and then ultimately having the chance of intervening early so we prevent those long-term implications of hearing loss in that critical period of child's development. So we're incredibly optimistic and passionate about the next phases, and I think working with Juan and the team has been an incredible opportunity for us.
And Juan, I know this is one of many projects that you have going, and AI is moving really slowly. It's going to move at a pace of knots. What is the vision that you have, and what are the areas that you're excited to dig into as you think about the future?
We have 1.3 billion people living in the world with a disability. We have half of the population do not have access to doctors. We have 40% of children around the world trying to learn and studying on materials that are not written in their language. The sky's the limit on how, what I think a lot of these problems are technically solved right now. I think the problem right now is, like I mentioned, is how can we work together to do that last mile and make sure that that technology is available and is used by so many, because this technology can certainly help the world. A lot of these problems, there are some of these problems where, because of the lack of, in many ways, the lack of doctors in rural areas, for example, and I think Rahim has worked on many of these, this is not just the solution, this is the only solution we have. And I think anything we can do to help make sure that this technology is available will help society. So,
Dr. Rahim, Dr. Juan, thank you so much for your time, for your passion, for taking a step out of your important role as an ENT doctor down in Brisbane. I really am excited. You know, the journey of being human includes disability, includes working with doctors, and the quicker and more efficiently we can drive that process leveraging AI. I'm excited about the future. Thank you both. Thank you for your time.
thank you, Jenny.
Thank you.
In animation, colorful, undulating bands frame the words, "Thank you for participating, and there's more to explore." Discover other resources in the top navigation bar.